So Cecil was talking about the 2.5 years that someone's in a long-term care facility. 2.7. Sorry, I missed point 2. And he was quoting that there were 1,095 beds. And we were doing a little bit of research on the number of seniors that there are in the province, approximately 16,000. If you correlate that, that means only 4.7% of the population ever see a long-term care facility, the senior population. Did you know that? Just wanted to share that little bit of trivia with you, because I think it's important for you to realize there are a lot of healthy seniors, right? And so often we hear a negative connotation to that, and I just need to highlight, you know, positively the amazing seniors that we have in our communities and around us that are very healthy and active, I might add. So I just wanted to make that point. Cecil, I appreciate the numbers that you shared as well. The Council of Federation and the Health Innovation Working Group, that was phenomenal in July last year when they did highlight the importance of awareness and early diagnosis for dementia. So here we are, not more than 6 months out, sitting at this conference, and you're hearing not only myself speaking to this, but we have other people within government speaking to it, researchers are speaking about it, we had the Summit on Dementia. And the Alzheimer Society is an important part of that. And why are we an important part of the post-diagnosis? Because there are 13 years that you live in the community. And who supports you then? Where do you go for your education and information? So from the point of diagnosis, we put the rubber to the road 2 years ago and piloted the First Link program. And the First Link program is when you are diagnosed, the physician would be making a direct referral to the Alzheimer Society. There is a 4-part education series specifically for caregivers that goes through It's Dementia, Now What is one module. The second one is day-to-day living. The third one is who cares for the caregiver? And you can appreciate why we think that's so important. Because really, who stops and says, how are you doing today? Caregiver. How is your day going? How's your week going? What can I be doing for you? Right? And then the final one is planning for the future. So those are our 4-piece education modules. Now today we would have passed out to you on your table our programs and services. So the Alzheimer Society provides much more than that. But we really work with families over a large window of time. We're out there in the community offering education. We're there in the continuum of the provincial dementia strategy, if I'm allowed to speak to it, Cecil. In the continuum, the Alzheimer Society the community has an important role to play, and we're one part of that community piece. So our role is that education and support directly to you families. So we want to break down the silos in this dementia strategy and very clearly say, if my role is education at the Alzheimer Society, Kate, we're going to do that, and we're going to do that well. And so we're passionate about making sure that that happens. And it doesn't need to be duplicated elsewhere within the system of care. So we need to be working together, right, Joan Coffin? And so there are a number of people that I can look to in this room and say, we work well together because we reach out, the referrals are happening, we're intentioning to see that happen more. We need to see people within home care actually making referrals to the Alzheimer Society so that families get the education. And when I started, this is my 6th year, when I started at the Alzheimer Society, when someone came to me and said they already had a diagnosis of the disease and what type of dementia it was, I thought I was ready to start right into what are some of the things they've already decided and planned. And I became heightenedly aware that they don't even know what the diagnosis means, what that type of dementia means, or what is dementia. And so then I would go, oh dear, I'm apologizing, I need to step back and talk about, do you understand what that type of dementia means, and then continuing from there. So depending upon even the type of diagnosis, you might need to start your planning fairly quickly because you have a short window. you might have a short window, and you might even be going down the road of declaring competency for your loved one to make decisions around finances or a healthcare directive. So there's a lot of pieces, you know, that you know, you can be discussing and having in front of you, and so that early diagnosis piece and getting to the education is so key. So we've been talking today about the hope for tomorrow as well in the research, and the Alzheimer Society is providing the help for today. We certainly allocate dollars to research specifically, but we really want to be working with families on the ground now. As John mentioned earlier in his comments, as a caregiver, you know, he's thinking about today. That's great to talk about, you know, the research pieces, but that's not going to make a difference for me right now. It will make a difference, though, for me, as I look at my generation and the next generation, if in my family it's a genetic predisposition to this disease. So it may very well be part of my journey, or out of my siblings, there's 50%, so there's 4 of us that may either be carriers or actually live the journey of this disease based on the fact that we have had it in our family. So when I work and when we do what we're doing, I'm passionate about it. I'm passionate about the facilities that were built, because that might be where I'm living. And so when I go to the new facilities, I'm looking, going, would I pick out a room here? Well, I think I might. And then the older ones, not so much. No. So again, the Alzheimer Society is here to help for today. Education and support. The First Link program is very key, and we have a programs and services brochure there to give you more information. And Dr. Stoltz.